So what has Aerolase done to make the Era the new resurfacing device, the modern resurfacing device? Well, they've chosen very specific parameters to make it safe and effective. They chose the 2940 erbium wavelength that we talked about because it's the most efficient laser wavelength for absorption by water in the skin, meaning it has the cleanest ablation. They chose a 300 microsecond pulse duration with a collimated beam and a repetition rate of 1.5 to minimize the collateral thermal damage to the tissue around it, and also to decrease any pain. And with that minimal collateral thermal damage, you're actually able to avoid treatment demarcation lines that can happen with other devices. And so this has now enabled us to do partial face treatments or just treating specific areas if those are areas that are bothering people, really making it easier and more comfortable treatment. There's this new ability to treat partial face treatments. So because there's minimal thermal damage that's left over because there's less heat, because the pulse duration is so short, it makes a very gentle parameters so you can treat just specific areas that bother people. And this is depicted here in this diagram. And so before, with other systems, when you wanted to treat an area, you really had to treat an entire anatomic unit, which is the picture on the right, because if you didn't, you would have these demarcation lines. But because the Aerolase Era has optimized these parameters for us, we're actually able to treat specific functional aesthetic units, so individually, so we don't have to do a full face treatment if a patient's just coming in complaining about wrinkles along the lower eyelid, along the lower cheek, along the crow's feet. We can just target those individual areas as needed. Or if someone just comes in and they're complaining about wrinkles around the mouth, things like that. And the advantage of that is that there's less downtime when you're only treating some of these smaller areas. So there are three main protocols that we talk about with the LightPod Era, and Aerolase calls them the refresh, the reveal, and the renew. The refresh is essentially a superficial laser peel or a micro peel. And the idea is you're trying to refresh the skin. You're getting rid of the very, very top layers of the skin to make a smooth, uniform glow. This is the easiest treatment. Patients really just need topical anesthetic, and there's minimal downtime, maybe a little peeling afterwards, and patients really are happy with this treatment. I'd say it's the treatment that I use for pretty much every patient comes in at the end of the summer and they want to have a new fresh glow, get rid of some of their sun damage. This is what I start with. Then there are the patients who have a little bit more moderate sun damage, some moderate wrinkles, and that's when we go to the reveal, which is the mid-epidermal ablation. So we're treating a little bit deeper within the skin, and that's where we're starting to target more sun damage. So some more of the brown spots that we're seeing from sun damage, and some more of the lines that we see from aging. And the idea is to reveal the youthful skin. And then there are patients who come in who really have more extensive sun damage and extensive wrinkles, and that's when we use the renew. This is a gentle resurfacing for the deeper lines. Sometimes we'll use it for acne scars to renew and replenish all or most of the epidermal skin. And you can get some very impressive results. This is the most aggressive of the Era treatments, and oftentimes I do use nerve blocks to make this a comfortable procedure. But for the refresh, certainly topical anesthetic alone is enough to make the whole procedure very comfortable. And here, let's go through some of the before and afters and see what we can do. So here you can see using the micropeel, so that very superficial treatment protocol where you use a 10mm lens, you do one pass for the whole face at an energy level of 1. The Aerolase really has a very simple system. And you can see after just one treatment, you can see the reduction in the appearance of pore size is reduced. And this is quite an impressive result, this out of Dr. Zhang's group. Here, I'll show you a picture from our office. This is actually our office manager. And you can see before and then after just one treatment, you can see a reduction in the appearance of the pore size along the cheeks. And actually, we'll do a close-up on the next slide where you'll see a reduction in the pore size on the forehead. But also, she just has a better glow, a more even skin tone. And this is after just one treatment. Really easy, minimal downtime. After she went back to work on that Monday, I got a bunch of calls from some of the other doctors in our practice who said, "Oh, when can I come in to get mine done?" So I mean, it's really easy, looks great, and people are really happy. So here you see a close-up of the forehead here. So the appearance of pore size is reduced, the appearance of some of these brown spots is reduced. Gentle, it's just really nice light treatment that looks great. Here, a patient from Dr. Gordon, and what you can see, really nice results in treating the mid-epidermal level treatment. So this is a person who has more wrinkles, and more brown spots, and you can see really nice results in removing those brown spots, in removing those superficial wrinkles. Excellent results. Certainly the patient is very, very happy. Here, a more aggressive, this is the most aggressive of the treatments that we talked about, and you can see really impressive results. Here using a 6mm lens, doing about 4 passes over the whole face, again at an energy level of 1, really nice results in improving skin texture, skin quality, getting rid of brown spots. This one does have a little bit more downtime, certainly more downtime than the most superficial of the treatments, but really impressive results. Certainly the patient's very happy. And here you can see a patient who I would consider really severe solar elastosis, a lot of wrinkles, a lot of sun damage, and after 2 treatments, really impressive results in some of these deeper etched lines, which are very, very hard to treat. So here you can see a very similar treatment, except in terms of parameters, except there were multiple passes done here. So there was a 6mm lens for the whole face, 5 passes for the whole face, and when it says 5 to 8 passes, what happens is for the deeper etched lines, you do multiple passes. And by doing multiple passes, you're going a little bit deeper in those areas so you can smoothen those lines out more effectively. But really nice results after just 2 treatments. Here's a combination treatment. This patient received a sutured lift, which is becoming very, very popular. So you put these small suspending sutures that actually lift the skin, but at the same time, they also had a laser treatment with the Era. Again, that full epidermal replenishment laser, so that deepest laser, and really nice results in improving the texture. And I like this as a combination treatment. If you're going to combine it with the sutured lift, you could do it on the same visit. What I would recommend is that you do the sutured lift first and then do the laser, just for sake of for ease for you, because there can be a little bit of swelling after the laser, and therefore you want to make sure you're doing that after you've done the lift already. But really nice results as a combination treatment. Here you can see what the healing process is like. And so what you can see is a patient at baseline before treatment. You can see these marked crow's feet here. And then you can see after that moderately aggressive laser treatment, so a 6mm lens with only about 4 passes, really nice smoothening of the crow's feet. At 3 days post-treatment, just with nothing but aquaphor afterwards, you can see nice and smooth, just a little bit pink. And then by 5 days, fully reepithelialized. So really nice results with minimal downtime here. And what's becoming more and more popular is the use of these lasers to minimize the formation of scars after surgery. And so here you can see from Dr. Khatri's group the use of the laser on half of this scar at the time of suturing. So something's excised, it's sutured together, and before you put the surface sutures in, the edges are treated with the ablative laser to even out the edges so that they epithelialize together nice and beautifully. And what you can see is the treated section is flatter and smoother than the non-treated area. But what I use this device very, very frequently for, and it's one of my favorite uses, is for the revision of scars. So this is a patient who came in who had a benign tumor that had to be excised that was very, very large. After excision, everything's sutured together, and actually, sutured together beautifully. He didn't take great care of his wound, and he ended up having some puckering at the edges, partly because of not taking care of it, being over, excess movement. And what I said was, come on in. We saw him. I did 2 treatments with the Era, and what you can see is a beautiful result where barely perceptible scar here. And what I do with this is I contour the scar. And what I mean by that is I'll do 1 or 2 passes over the whole scar to superficially ablate the surface, making it very nice and even so that it can re-epithelialize together smoothly and evenly. But any of these thickened areas that are puckering, I actually will do multiple passes, contouring this to smoothen it out. The idea is that I want it to be a very even plane here, so that you can't tell the difference. There's no hills and valleys. Very nice and smooth. And that's how you get these beautiful results here. And obviously, you know, we're using this here off the face here very effectively with great results. And I think it's an excellent addition to any practice, especially any surgical practice. Here, with a very, very similar concept to what I just talked about, Dr. Klimova used this to revise a burn scar. And what you can see is there are these thickened areas over here and over here. And what you can do is by using the Aerolase and doing multiple passes and contouring as you need so that thicker areas get more passes and thinner areas get fewer passes, you're able to contour these scars to flatten them and make them much more even so they're much more aesthetically pleasing. And this is after 2 treatments. I mean, this is a dramatic result. Certainly, you could consider doing more in the future and even flattening this a little bit further. And then, you know, you can also use the Aerolase Neo, the non-ablative laser, to then go over this area to help reduce the redness. You know, an excellent combination treatment. Another combination treatment, which is really fantastic, and this picture is from David Friedman. What you can see is a combination of the LightPod Neo, which is a non-ablative laser from Aerolase, with the LightPod Era, which is the one we've been talking about this whole time, the ablative laser. And what you do is you do 3 passes with this non-ablative laser, the Neo, which allows for deep formation of collagen and collagen remodeling. And then at the very end, you do a 4th pass over the whole face, very, very superficially with a 10mm spot size, and resurface the superficial portion of the skin. And what you can see before and after 2 treatments, a really nice reduction in the redness. So all this redness is gone, and some of the brown is all reduced, and improvement in the texture and the quality of the skin. And this is after just 2 treatments, which is, you know, really excellent results and really quick results. You certainly can treat off the face. You can treat the neck, the hands, the décolleté to improve textural issues, but also improve that uneven dyspigmentation that can happen from photo damage over time. When you're doing that, I do recommend that you lower the settings, meaning that you're using a lower fluence and really being extra cautious, but certainly can be done very, very safely. It just has to be done conservatively. And that's because healing tends to be slower off the face. So you really want to be a little bit more superficial. But, you know, certainly we do off-the-face scar revision treatment all the time, and it's a great application for the Era. So what are the common LightPod Era treatments that we do in our office? I think the most common one are the laser micropeels, the superficial peels, because there's pretty much no one who doesn't need a little, you know, repair from the photo damage that they get at the end of the summer. And so I, you know, tell people to come in once a year and get a treatment, really easy. Or if someone's kind of planning having an event and they want to really make sure that their skin is glowing as best as they can, it's a great treatment. You know, just make sure you have give them a little bit of time before they go for the event. But certainly we do the deeper resurfacing for our patients who come in with severe solar elastosis, that really severe sun damage. And I think also, you know, scar revision is a big opportunity for us in the office. I have a lot of patients who come in who have seen other doctors or have had a surgery elsewhere, and they want to come in, and they come in and they say, what can I do about the scar? I'm so unhappy about a scar. And this is a great option and a great tool for us to treat those, and that's a person that now becomes a patient of yours. It's a great opportunity, and patients really appreciate it.